Hi, everybody. Welcome to episode 125 of ASBN Live. On behalf of the American Sustainable Business Network, I'm Tulasi Sivalingam, the Senior Manager of Events and Programming. As you all know, by the end of this month, we will have a decision from the Supreme Court on the overturning of Roe v. Wade. ASBN held a members-only business forum on reproductive healthcare when the news was announced. And during that meeting, ASBN member Dr. Sophia Yen actively brought forward resources and information, and we knew we had to take her up on her offer to do a follow-up session open to the public to share this useful information. We're also so thrilled that Shelley Alpern and Amy Merrill stepped up to share resources from their respective organizations too. So now it's my pleasure to introduce our panelists and have Dr. Sophia Yen take over and begin with her segment.
Hi, everybody. Thank you so much for joining us today. I'm Dr. Sophia Yen. My mom said, claim all your titles. So everybody claim all your titles. I'm the CEO and co-founder of Pandia Health, and we're the only women-founded, women-led, doctor-led birth control delivery company. We can deliver to all 50 states, and we can write the prescription in 14 states, which covers about 56% of the population, and we encourage birth control tourism. So if you're not in a state that we can serve, then you can just drive 30 minutes, get in a state we serve, fill out the questionnaire, pay us $20, and then we can ship to all 50 states. So my background, I went to MIT, UCSF medical school, Children's Oakland for residency, back to UCSF for adolescent medicine, then to Berkeley to get all the degrees in the Bay Area for NPH, Masters of Public Health and Maternal Child Health, and ended up a clinical associate professor at Stanford in the Department of Pediatrics in the Division of Adolescent Medicine. And then 8 years ago, started Pandia Health. Today, I just want to make sure as employers that you are aware that under the Affordable Care Act, if you're providing insurance, birth control should be available to all of your employees with no copay, no deductible. And so if they are paying anything for their birth control on insurance, they should not be. The only time they should be paying anything for birth control on insurance is if the patient is demanding a specific brand when there's a generic that could satisfy that equation. And then it's on the patient because they're demanding a brand when there's a generic. But know that for birth control, 95% of birth control pills are generic. So they should be pretty much okay. And at Pandia Health, we take insurance, but we also have cash. And the reason I bring that up is the cash option is pretty inexpensive. It's $15, 3-pack minimum. So that's less than 50 cents a day. And if you want 1 pack, it's $20 once a month to cover shipping, handling, and overhead. So birth control is quite economical. And then as employers and just people that are well educated, I hope you all know all the forms of birth control and that the new paradigm in birth control education is to start with the best and work your way down. And so this is going to blow your mind because I bet you none of you can guess what's the most effective form of birth control, of course, outside of abstinence, masturbation, and whatnot. The most effective form of birth control is the implant. It beats vasectomy. And I was like, what? How does the implant beat vasectomy? But if you look at the statistics, the implant beats vasectomy. And for those of you who don't or don't know, the implant, you put it in your arm, it sits there for 3 years and it's easily removable. So it's part of this family called LARC, long-acting reversible contraceptive, and really important for people to know that it's reversible. And then the second most effective, as I alluded to, is vasectomy. Vasectomy is a very easy process. It's exterior, it's snip, snip, much better than the invasive tubal ligation. And so you have implant, you have vasectomy, then you have IUD with hormone. So crazy fact, IUD with hormone beats snip, snip, burn, take out tubes in a woman. And it's like, again, wow, how does it beat that? But on the flip side, the body really, really wants to get pregnant. So very important that anybody who doesn't want to get pregnant get on some good birth control. And so then comes IUD with hormone, comes tubal ligation, which is snip, snip, take out internally in a woman, very invasive, but also easy to do if she's having a C-section, just throw that in. And if she's done, then that's a great opportunity, a great option. And then after tubal ligation comes copper IUD. Know that the main side effects of that is more blood, more cramps. So if you're a person who feels every part of your period, not a good option. If you're a person who's like, oh, is that blood running down my leg with your period? Then yes, you are a good candidate for the copper IUD because you don't notice so much. And if you bleed like stink, copper IUD may be not the good one for you. Then comes the shot. The negative of the shot is that it gives people the munchies. If you're on the skinnier side, it's not good for your bone density, but anything is better than pregnant. And then comes the ring. Know that there's two flavors of the ring. There's a 1-year ring, which I was like, oh, this is going to totally destroy the IUD market because you don't need a doctor to put it in. You just put it in your vagina, and no matter how, where, or how it is, as long as it's in there, it's delivering medication. The only restriction I would say on that is as an adolescent medicine special doctor, you don't want to use that ring until you're 30 years old. But if you're 30 years old and up, go for it. And the reason you don't want to use it under 30 is because it only has 13 micrograms of estrogen. So that's not good enough to sustain the bone density that we need during those years where you're gathering all your bone in your bone bank, which is what we teach young people. Is from age 15 to 30 or 35, you're putting on that bone density. And if you don't have enough estrogen, then that doesn't happen. So, but if you're 30 and above, go for it. Anovera is a 1-year system, and it can last for entire. You just throw it up there. There's the NuvaRing, which is every single month, and that does have enough. Well, it has more estrogen, so that one's okay. And then comes the birth control patch, the birth control pill. So ring, patch, pill, and then condoms. And then there's a new non-hormonal birth control, which says it's not a spermicide, but it pretty much works the same efficacy as a spermicide. It's just something that acidifies the vagina, makes it hostile to sperm. And it's not technically a spermicide, and that doesn't kill sperm, but it makes it difficult for the sperm to get where it is. I would never use that alone. I would use that condoms plus that method. And again, it has the same equivalent effect as spermicide. So I want to just use spermicide, which is crazy, less expensive because it's a new drug called Phexxi, but it costs like $200, which is really, really crazy. So that's the rundown on birth control. And then as a person with a uterus, I always encourage, I'm looking for my, condom bag. And people are like, but you're married. Why would you use condoms? Don't you trust your husband? And I was like, I don't like to leak sperm for 24 hours. So use condoms plus a hormonal method, and you will decrease your risk of pregnancy, but you will also decrease the disruption of your vaginal flora, pushing you towards bacterial vaginosis or yeast infection, and just who likes to leak sperm for 24 hours. So just to encourage people, condoms plus, having, bowls of condoms at events that you have. And then just as an aside, condomdepot.com has a great website that compares condoms. The person with the penis gave it a B+. The person with the uterus gave it an A-. And so at our clinic at Stanford, we have the best condoms with the best sensation with least risk of breakage, because I feel that if you give people good condoms, then they are more likely to use it. So those are all my tips. Oh, and then emergency contraception. So I do an article, What Your Doctor Doesn't Know Could End You Up Pregnant with Bad Bones and Horrible Birth Control Side Effects. So emergency contraception, know that there are 4 options for emergency contraception. So I make my fingers spread out. Can't figure that out. Okay, there we go. And that number 1 is, God forbid, somebody sexually assaulted, but you could go into the ER and ask for an IUD. So the copper IUD is the most effective emergency contraception, 99.99999% effective in preventing a pregnancy within 5 days after a contraceptive failure. So if somebody's sexually assaulted, if the condom popped, if you forgot to take your birth control pill, patch, ring for 3 days in a row without taking it for 21 days ahead of time in succession, then you are at risk of pregnancy. So you could go to the ER, ask them to throw up a copper IUD. The second one that I pair with that was of the 4 options is the hormonal ID, has also been tested, and it had a failure rate of, I think, like 1 or 3 out of 333 patients that they tested it in. So that's a pretty good efficacy rate. The next one, I gave a talk to a bunch of Stanford doctors, 60 Stanford doctors, only 1 doctor out of 60 knew about it. And if that's Stanford, imagine the rest of the country. So prescription emergency contraception, it's called Ella, and it works better than Plan B and its generics at every single time point, and it works for a BMI of up to 35. So if it were me, my daughter, my friend, my patient, anybody with a uterus, I would go with Ella. And I recommend for emergency contraception, anybody with a uterus of reproductive age, unless you're on the implant or the shot, which is pretty amazing, or the IUD, should have a pack of emergency contraception sitting in the back of the room like a fire extinguisher. And I tell my patients, if the condom pops at 3 a.m., I want that medicine in that person's mouth that you're preventing the pregnancy at 3:10. I don't want you cuddling, snuggling, huddling, waiting till the morning after because you heard it was a morning after pill, or waiting until 5 days after, because I'm telling you now, you can use any emergency contraceptive for up to 5 days after, but it's better ASAP. So again, condom pops at 3 a.m., medication in the mouth at 3:10. To the best of your ability. The 5-day is for your friend who shows up on day 3 and is like, oh my God, the condom popped. And you're like, here, take the emergency contraception. So again, Ella is only available by prescription, but you can ask your doctor to prescribe it ahead of time. And at Pandia Health, we even go one step further in the note to the pharmacy. Please give the patient the one with the farthest expiration date. This is for future use, because if you don't do that, then they'll give you the one that expires today, because they assume you're taking it today and now as an emergency. And if you're taking it today and now, then yes, tell them to give you the one with today or around today's expiration date, and then refill it for future in case of emergency. And then if you don't have insurance, you can still get a prescription. It's about $40, $45, but that's much cheaper than an abortion, a pregnancy that you don't want. And then Plan B is the 3rd most effective. So if you're using Plan B, you're using the 3rd most effective out of 4 options. And if you have insurance and healthcare, which you are employers, and hopefully you're giving all your employees insurance, they should not be relying on Plan B and its generics. 1, know that there are generics. If you walk in and you say Plan B, $60. If you go with a generic, I just went on Amazon and there's some price gouging going on. So there's like My Way, which is the probably a bigger known Plan B, and Plan B is charging 60-ish. My Way is charging 40 to 50-ish, and there are generics for 10. So make sure you know that the generic is perfectly fine. Just make sure it isn't expired and make sure that it's a reputable seller. But the negative on Plan B is it has a BMI limitation, body mass index. So it really should have a sticker on all of the generics that say, check your BMI. If your BMI is 26 or greater, Plan B has a lower efficacy. And if it's 30 or greater, it doesn't work at all. And so the example I give you is, look at me. My BMI is like 25. And if I go to Chicago, which I did one weekend and gain 8 pounds because I ate a ton of food, then it's BMI 26. So 66% of this country has a BMI of 26 or greater. So 2/3 of the people should not be taking Plan B. But everybody's really pushing it and they're not telling people. They're doing vending machines on college campuses, which is great for access, but please check your BMI, because your BMI could be high because of sports and muscles. Schwarzenegger at his peak had a BMI of 45. Certainly any athlete might have a higher BMI, and then just in general, America has a BMI. So that's our Pandia PSA, public service announcement. Please check your BMI. Don't do Plan B if you can get Ella. And I'm not paid by Ella any money. I just want to prevent unplanned pregnancy in this country. And then lastly, there's the USP or USP method. Someday I'll remember it, but it's 4 birth control pills now, 4 birth control in 12 hours. It's the least effective method. But if you're stuck in the middle of nowhere and you have a couple of pack of pills, then yeah, do that. But if it were me, my friend, my daughter, my patient, I would go with the IUDs, number 1. Number 2, Ella, if you're not into doing a surgical procedure. But again, it's not that big of a procedure, but you have to have access. And then number 3, Plan B and generics. Number 4, the USP method. And then to wrap it up, because some of you may be in more conservative states, I want to open your minds to the idea of hashtag periods optional. So if you go to pandiahealth.com/periods optional, at the bottom is my TEDx talk. But as we like to speak on the internet, TLDR, the summary is that currently we're having 350 to 400 periods in our lifetimes, but it is actually more natural to have 100 periods in our lifetime. And the reason why is because with 100 periods, you're in a community that has 8 babies and is breastfeeding for 12 to 18 months. So you're spending 20 plus odd years breastfeeding and being pregnant. How many periods you have when you're pregnant? 0. How many periods you have when you're exclusively breastfeeding? 0. So it is more natural to have 100 periods rather than 350 to 400. And so if you're on the IUD with hormone, the implant or the shot, there's 30% that will have no period. And then the other 70% will have much lighter periods. With the pill, the patch, the ring, you can get to 0 periods. And every time you build that lining of your uterus, you risk uterine cancer. Every time you pop out the egg or heel, we don't know which one it is, or something to do with the tube, you increase your risk of ovarian cancer. And so if you can turn off the ovaries from popping out the egg every single month with the pill, patch, ring, or if you can stop building up that lining every month, you decrease your risk of ovarian and endometrial cancer, lining of the uterus cancer. And then you also decrease your risk of colorectal cancer, because the colon is around the uterus. And so the way I think of it is the uterus is like up and down, and the colon is around it. It's like, I'm sorry. So then it either decides to run faster and give you diarrhea, or it slows down and gives you constipation. And so like 30% of women that have periods have some GI side effect. And then on that note, for employers to know that the #1 cause of missed work and school under the age of 25 is painful, heavy periods. Every time I give a talk, 10% of the women at the end of the talk will come up to me and be like, yes, I miss like 1 to 3 days of work every single month. And it's like, girlfriend, don't you have insurance? Please see a doctor. So if please, public service announcement, put it out there to your employees. If you are missing work because you have horrible periods, please see a doctor. And they can, first line treatment is just ibuprofen, 600 milligrams, 3 times a day with food for up to 5 days. If they don't take without food, then they could risk an ulcer. And that decreases the blood and the pain by 30%. But failing that, then you can go on one of the hormonal methods and decrease your periods or turn off your periods altogether. So please check out pandiahealth.com/periods optional. Please share with your employees Pandia Health's free birth control delivery service. And our prescribing service is just $20 once a year to use our expert birth control doctors. We're starting with birth control. We're going to add on acne. We're going to add on menopause. And we're the only doctor-led, the only academic doctor-led, and the only women-founded and women-led company in this space. And now I'm going to pass the baton on to Shelley.
Thank you, Sophia. That was so really interesting. And I noticed that someone said in the Q&A, do you have this talk on YouTube? Do you have this talk on YouTube?
So as I mentioned, pandiahealth.com/periods optional. At the bottom is my TEDx talk, which is also on YouTube. But I will drop it in the chat. Thank you so much for picking that question up.
Sure. And so I'm going to share screen and this will take a moment. So if you wanted to respond to anything else going on in the chat, please do so.
Yes, let me see. Menopause, just know that I'm of menopausal age. And so all my friends like menopause. And I'm like, yes. I will find the best treatment for menopause. I will share it with everybody. And if you don't want the best treatment, which I'm learning is either the patch estrogen or the pill estrogen with some progesterone every single day if you don't want to bleed, which is me, or for a couple days if you're into bleeding, or the IUD with hormones. So that is the answer to menopause right now. The other answer to menopause is you want to get on the hormone before 60. And the mechanism, the way I look at it, is we were supposed to die after we gave babies. And so they take away our estrogen and like, die, go. You don't need the estrogen, but we should just continue the estrogen. But if you take it away and then you put it back, that's where the danger happens, is if you come off your estrogen, you turn into a guy with bad arteries, and then you throw estrogen, which causes blood clots. Not a good situation. So if you're going to do the hormone therapy, do it before 60. It's good for your brain, your bones, and your heart. But if you aren't having any symptoms, then you don't necessarily need hormone therapy. But if you're having any symptoms or you have risk for osteoporosis, such as Asians and Blacks and Latinos, we have lactose intolerance and therefore not so good on our milk, then that's something to consider. Or if you have a family history of cardiac badness.
Thank you for your patience, and thank you for the opportunity to talk to you all. This is going to be completely different from Sophia's presentation. I work with Rhia Ventures, and we're a women-led social impact organization. Our mission is to create a more vibrant U.S. market for sexual, reproductive, and maternal health care that produces equitable health outcomes for all. And we do this through technical assistance, market analysis. We do direct investments through a venture capital fund that's embedded within our nonprofit structure that puts capital into early stage companies, venture capital that is, focusing on reproductive and maternal health care products and services. And I direct the corporate engagement program. Next slide, please. And what that means is that I work with a network of about 40 institutional investors, and we are shareholder advocates on this issue. And we have been talking to corporations for the last several years, really trying to get them ready for this moment that we, and so many of you have so long seen coming, where abortion access is going to be greatly restricted even more restricted, I should say, in about half the country. And we have approached companies telling them that our agenda is fourfold. We want to talk to them about their insurance, their benefits, their stances on public policy, and the extent to which their political donations may be empowering anti-choice politicians. And the tools that we've used to mobilize around this is that we've created a business case for reproductive care and also in maternal health care, a separate one, which I'll discuss a little bit more in a minute. And then there's the direct engagement that we have with companies. And we have also started writing directly to lawmakers to encourage them to expand rather than restrict access to abortion. Next slide, please. And I'm really excited to be talking to ASBN because a lot of the companies that we talk to, are polite listeners, but have been taking a very much a wait and see approach on this issue, or giving us all sorts of reasons why they can't act to do things. Well, this is what we've been asking them to do, and what we would ask all of your companies to look more closely at. One is to provide better insurance and benefits. You do an audit to make sure that your insurance coverage includes coverage for all types of contraception, not just the types that are mandated by the Affordable Care Act. For example, you may not know that the ACA doesn't insist that companies insure vasectomy. So make sure, a lot of companies, even without really knowing it or looking into it too closely, don't even realize that they're just compliant with the ACA and they're not digging a little further to do more. Make sure that all abortions are covered without restriction. Again, we found talking with a lot of companies that they don't think about it, or they just take what's off the shelf offered by their insurance providers, and they don't even realize that they have restrictions on the types of abortions that they will cover. So it's very important to ask about this. Also, make sure that you're using clear language in your explanations of what your insurance covers. Some insurance documents will say that they cover medically necessary or therapeutic abortions, but unless you're a doctor, you may not know what that means and what that includes and what that doesn't include. So we really recommend that that companies just be very frank and just say this includes elective abortions, so that there's no confusion, because you don't know how well versed an employee who's very stressed out when they're looking for this information, is on what is medically necessary or therapeutic. That actually clear communication is a really important part of creating a supportive culture around this. We recommend that, particularly when the Supreme Court comes out with its ruling, or when states, a lot of states are going to be imposing harsh restrictions in the next few months and over the years. When that happens, just re-up this information for the benefit of your employees. And, stay in touch with them, make sure that you have somebody who's really informed about the ins and outs of your policies, and that person, they know who that person is. Also, you may want to consider your state laws if you are expanding your operations. You might be less interested in going into some of those states that are really cracking down on abortion or make noises about coming after contraception, which some are doing. Also, make sure that you allow adequate paid time off for abortion. What we have learned from a leading clinic is that you should allow 3 days for a first trimester, 5 days for a second trimester, and 10 days for a third trimester. And of course, you can be flexible and add more if these turn out to be complicated procedures, and employees need more. So we're also asking companies to take public policy stands. So I think, the lowest hanging fruit for a small company would be to sign on to a public statement like "Don't ban equality," and I'll talk about that in a minute. You could become a business for birth control partner with Planned Parenthood. You could sign on to business amicus briefs that will certainly come up as these laws, come under challenge in the future. And we're asking companies to actively lobby against restrictions. So there's a prediction that about half of the companies states will immediately move to impose greater abortion restrictions. Not all of that is inevitable. There may be states that that are winnable. And so we encourage you to really monitor the situation. And if you have a government affairs staff, or if you just have a motivated CEO, use your voice. And if there's any companies listening in on this that have political donations programs, either through a PAC or through the corporate treasury, we ask you to really examine whether you want to continue giving to politicians that are actively working to restrict access to reproductive health care. You may want to, delineate your criteria or impose a screen in that regard. Next slide, please. So the Don't Ban Equality Pledge, which I mentioned, is going to be relaunched just after the SCOTUS decision is handed down, which is going to be certainly within the next week or 10 days. If any of you listening are interested in adding your name to this list of companies, just let me know and I'll put you in touch with my colleagues within that coalition who are doing that. This is a statement. Unfortunately, you can only see part of the statement here, but just go to don'tbanequality.org. That basically affirms where companies are affirming their support for their employees who need access to abortion. And several hundred companies over time have signed on to it. And as I said, it's going to be re-upped this month. Next slide, please. And Rhia Ventures has developed a few resources that we hope will be helpful to you. The one on the left is Hidden Value, the business case for reproductive health. It's as the title implies, it is a business case. And we make 6 main arguments for businesses to invest more in insurance and benefits and the other things I've spoken about. And it's about a 40-page document. It's very comprehensive. We are Also going to be releasing this within a day or so of the SCOTUS ruling, so that we can incorporate the ruling into the document. There is the current version is available on our website, rhiaventures.org, in the corporate engagement section. We also have a one-page brief where that you can see in the middle, which summarizes the actions that we're encouraging companies to take. And we have a companion report to Hidden Value called From Here to Maternity, which is the business case around companies investing more into their maternal health care. Next slide, please. Some top line highlights from Hidden Value. I mentioned that we make six main arguments. And they're centered around the benefits to companies around investing more in reproductive healthcare, include widening the pipeline and helping to attract talent, retaining existing talent and supporting them, providing high impact benefits with low cost investments, meeting DEI goals, since restrictive reproductive healthcare laws impacts women of color more than it does other birthing people. Restrictive laws are really get in the way of being able to attract and retain women of color. And also helping companies prepare for greater scrutiny, which is coming from the media, employees, investors like the ones I work with. And lastly, we added a new section called Economic Impact. And there's a recent study estimating that abortion restrictions may be keeping over 500,000 women in their reproductive years from the workforce each year, and costing multiple billions to state economies and the US economy as a whole. Next slide, please. We also have this database that we just launched and are maintaining on our webpage. And this is a list of companies that are responding positively to recent developments. And if your company is one of them, please get in touch with us so that you can get credit where credit is due. We also have the visual shows that list of companies with 500 plus employees, but we have another section for smaller employees. So do get in touch. Next slide, please. And I thought it might be helpful to share the list of companies we've found so far that are traveling costs for out-of-state abortions, in case you need to make that case internally and get that benefit up and running. So there's different ways that companies are doing this. Some are using third-party administrators. Some are going through insurance. And just for lack of time, I won't go into everything that we've learned about the different ways that companies are doing it. We're still really gathering the information. It's so new that companies are still figuring out how to do this. I would say if you want to look into this, I'd be happy to email with anyone directly. And I can also put you in touch with some of the companies listed who would be available to take questions from peer companies. I think that's the last slide, but let's see what's next. Oh, no. I also wanted to share that the public conversation around this has really changed in the last, especially the last 9 months since Texas implemented its very extreme anti-abortion legislation, and now all eyes are on companies. You can see the very active media interest. The shareholders that I work with have filed close to 30 shareholder proposals at companies, trying to sort of prod them to make this a more urgent concern. And the response from other shareholders who are voting on these proposals has been very positive. So we'll continue that. Trying to mobilize companies to be active in this regard. Employees are, of course, wondering what their benefits are. And so you can probably expect a lot of interest from people internally. And yeah, I expect another, there was an incredible wave of interest in this after the SCOTUS leak happened, and I expect another wave of interest in this and spotlight on this after the decision drops. Next slide, please. There will be more battles ahead. This SCOTUS decision is not going to be the end of restrictions on abortion. It's really going to be the beginning. We're going to see a lot of state legislators trying to pass bills that are as extreme as the Texas and Oklahoma bills that create a bounty hunter provision to turn in people or companies who are aiding, abetting, or ensuring an abortion. And there will be more creative bills coming down the line. So it's very important for companies to monitor this and to stay in close touch with their own legal counsel and to act as a cohort and to be urging your own trade associations or healthcare trade associations, insurance trade associations to be providing all the advice on how to deal with these changes in laws. Next slide, please. Okay, well, that's actually getting into, I'm going to cut it off here. This is sort of the bonus slides for people who want more, but not essential to my main message. And I will happy to take, I don't know if anybody's monitoring the chat, and if there are questions that are better for me to take now, or whether we should defer. Velasi, any preference on that?
We can wait till the end of the presentations to take the questions.
Okay, then
that'll give time for more to come into the Q&A box as well.
Great, then happy to turn it over to Amy, and thanks for your attention, everyone.
Great, thanks so much, Shelley, and everyone. This is, and Sophia as well. This is really wonderful. I am going to share my screen here. Let me be sure this is working. Let's see. Are you all seeing my slide?
It looks like it's loading up.
Loading, okay.
It should show up any minute now.
Maybe I will do, let me try it again. Just
okay.
Gonna switch to slideshow mode and do exactly what I did earlier. How's that?
Perfect.
Yes.
Okay. Okay, great. So thanks so much for having me. My name is Amy Merrill. I use she, hers pronouns, and I'm the digital director and co-founder of Plan C, an information campaign about abortion pill access. And I'm grateful to be able to share a little bit more information here today. So we're just going to go over a few areas: abortion pill basics, Plan C, and what we maintain on our site is called, we call it the guide, and then a little bit more about our communications campaign. So first off, we'll start with the basics, because we've realized that despite this method being around for decades and being FDA approved for 20 plus years, still so many people don't know what abortion pills are, let alone how people are accessing them for safe, self-managed abortion. So the abortion pill is actually a combination of two medications, mifepristone and misoprostol. And the medications stop a pregnancy from developing, and then the second medication causes cramping and bleeding to empty the uterus. It is medically very similar to having a miscarriage. And so it's also known as medication abortion. If you hear about in a clinic the option of a surgical or medication abortion, this is what they're talking about with the second. So a lot of people want to know, is it safe? Does it work? Is it effective? What's the deal? And abortion with pills is very common in the US. More than half of abortions are currently done with pills. And in other countries around the world, it's even more common. We know that in some European countries, up to 90% of abortions are currently being done with pills. And like I mentioned, the medication has been approved for over 20 years by the FDA. It's statistically deemed safer than taking Tylenol. And it's shown to be 98% effective at ending a pregnancy. And we're talking about early term here. Most of the information on our site is geared at ending early pregnancy. So they are recommended for up to 12 weeks. Some providers do 11 weeks, 10 weeks, but most recently, the telehealth providers that we list on our guide are recommending for use up to 12 weeks after last menstrual period. And we also reference legal risk on our website. So we'll get into that a little bit more, but as Shelley has described, we live in a complex landscape right now. And so our site, as we describe the options for self-managed abortion and describe what this medication is and where people are accessing it, we're also referencing legal risk and resources that are available for people to understand their own risk. So what is Plan C? What is Plan C? We're not a provider of pills. We're not a business or a medical provider. We're an information campaign on abortion pills, how people are getting them through mainstream services like clinics or telehealth, or through alternate routes of access in states where unjust laws are currently restricting access to care. So even as politicians block access, there are still ways that people are getting abortion pills from all 50 states, which again, we find is a really important point to share because the laws are specifically designed to create so much fear and create real blocks to shut clinics and penalize providers, that we want to make sure people understand that they still have options, as well as understanding all of the context around what it would mean to make a decision for themselves. So all of the resources that we're sharing are in support of a medically safe, self-managed abortion and an experience that centers the individual and their own decision. And this is a global movement. We are, abortion feels like a very US issue, but obviously abortion is happening all around the world, as it has forever. And this particular method of self-managed abortion began in Brazil. Women discovered it as a side effect to medication and started to share information and use it themselves. It's since grown to be a part of established medical systems and to continue to be a self-managed method. And in other countries, abortion pills are easily accessible and affordable and able to be direct to individuals. And again, we feel like that's really important context because of where we're at in the US. So I'm just going to show a quick video. If this works, let's see. I'm going to make this large. And this is an animation that our team created a few years ago to give a snapshot of the situation, of the reality.
In countries around the world.
Oops, starting over.
What if there was a modern way to safely and affordably end an early pregnancy at home? There is. In countries around the world, people are picking up abortion pills from pharmacies or ordering them through the mail and taking them at home, all for under $100. After decades of political restrictions, some medical professionals in the US are finally providing telemedicine and mail options, making safe, self-managed abortion more accessible. In the modern world, a late period doesn't need a doctor's office for a clinic visit. It just requires 5 little pills. Visit plancpills.org to learn more.
All right, so I will say, let me actually pause share for a minute while I get my slides back. These days we like to make sure that we are also including the fact that people are always going to have a need for, there will always be some people that have a need for in-person care. And as these really devastating restrictions come down, we want to say, this information needs to be available and it needs to live alongside of the different points of access that someone might be able to seek out so that they can, again, make a fully informed decision that's best for them. And there are so many organizations working at abortion access from all sides that we partner with and that we highlight to be sure, again, someone understands if they're seeking clinic care, if they're seeking funding, if they're wanting to travel, that all of these options are made known to them. So let me share back to my screen. So just a quick snapshot of the US ecosystem as Plan C sees it. The amazing thing is that over the last couple of years with the pandemic, telehealth abortion providers have come online in more than 20 states. There's services in half the country that are giving this modern care through mainstream methods. There's companies like Abortion on Demand, My Choice, Hey Jane, that are doing this service in states where they're able, where telehealth abortion is permitted. And the other states are currently being served by an international human rights driven organization called Aid Access. So in other states where restrictions occur, the doctor and team over at Aid Access is still offering care from overseas, and the individual is going online and finding Aid Access and seeking out this care. And online pharmacies have also come online that are shipping abortion pills. There are also blocks in place until very recently where the FDA was prohibiting this, but now pharmacies like Honeybee are working with these telehealth providers and shipping medications just like they would any other medication through the mail for mail order. And online pharmacies that operate in other ways. You know, people go online all the time these days for their pharmaceuticals, and there are many online pharmacies that we have researched and that we list on our guide that currently ship abortion pills, and people are using these as well. And they're using them because they're accessible from restricted states. They're using them because they're affordable, and they're finding them through Google searches and through sources like our guide. So alongside of this, really important free resources exist, and those include resources like the M&A hotline, which stands for Miscarriage and Abortion Hotline. This is a doctor-supported hotline that is going to answer any question a person has about their particular medical situation, their particular decision or process with self-managed abortion. If, When, How is a legal organization, Lawyers for Reproductive Justice, and they run a Repro Legal helpline. These are both free resources, and someone can call up with any legal questions they might have from any state and get advice or guidance or questions answered. There's also funding and more funding for online access. You know, for a time, abortion funds were very dedicated to serving people with their in-clinic and in-person needs, and funds are now recognizing the need to be supporting people as they go online and seek their care, and so that's all evolving very quickly. There's also reproductive justice, reproductive health organizations in all states across the country that are working very hard to ensure that people understand all of their options. And we build partnerships with them to ensure that information about self-managed abortion and abortion pills is able to get out to communities in ways that feels best, in ways that is respectful and appropriate for that community. So all of these things are happening. And a few other really important pieces that I'll just mention quickly are breakthrough strategies like mail forwarding to states that have restrictions. This is something we've been researching and looking into, where people set up a temporary mailbox so that they can receive mail in states where there are restrictions to telehealth abortion. And many states like New York and California are even working on provider protections, like protecting telehealth providers in those states that want to be serving other states and preventing something from happening to them if the state has restrictions. So just giving you again, this might not relate to your individual decisions at your company and with your HR policies and your coverage, but giving you a snapshot of the landscape as we see it for self-managed abortion. And pills for future use, finally, is a really interesting development where advanced provision of pills, which is a really common approach with other medications, is becoming more common with abortion pills. And telehealth providers across the country are offering this right now. If someone visits their site and says they want pills in advance, they are giving them to them so that the person has abortion pills in their medicine cabinet and can have even more control over when they use them, and even more control over their experience and their ability to have an abortion. So this is another piece of information we've been sharing as we have learned about it. And I'll quickly go through the Plan C guide. So what is the guide to pills? We have a very robust directory on our website currently that includes a slew of FAQs that addresses everything from people's basic medical questions to questions like, can I get in trouble? We have a state-by-state guide to sources of pills, which is the only directory of its kind. So if you go to our website, you can search and select your state, and you can see what's available from telehealth abortion providers to online pharmacies that serve all the states. You can see price points and ship times. It's a range from, a lot of the telehealth providers, again, are activists as well, and they are offering sliding scale. So a lot of the providers will basically allow someone to pay what they can or pay, minimum amount. And the price points go from something like, around $100. Advanced provision right now, I think, is usually around $100. Pills and telehealth starts around $150 typically, and it goes up to a couple $100s. And our directory also includes these creative ways to access pills for restricted states. So again, we're in the business of sharing information. We're in the business of sharing research and everything that we know about the current landscape. So we're also sharing information that we have gathered about those creative ways people are already accessing abortion pills. And the hotlines. So we understand self-managed abortion is a really new idea for people, and everyone wants a different kind of experience. So they might want one of the hotlines I mentioned before. They might want an emotional support hotline to just talk about their choice of abortion, or talk about what's going to happen next. And we also list other resources and all sorts of different nonprofit organizations, groups that are working on abortion and self-managed abortion, just to be sure we give someone a fully comprehensive hub, a guide that they can use for their own decision-making and their own experience. So this is what our listings look like. You can see we include what we know about price point. We include what we know about delivery. We've tested them. We include everything that we know about up to how many weeks that they serve people. And this, you can see the difference. This is a telehealth provider. These are all the states that they serve. This will come up, I think I chose California, and this comes up at the top of the California listings. And then in a restricted state, online pharmacies like this will come up, where Abortion RX is shipping for $239. It takes a little over a week, and it's abortion pills. And in that case, often someone is using something like the M&A hotline to get their questions answered if they're ordering from an online pharmacy. So why do people choose to self-manage? Again, I know we're here to talk about workplaces and support of abortion, which is so important, and figuring out all of these nuances around insurance and around covering travel and around how to support employees in their reproductive health care overall. And what we have seen, what we know from the research, is that people are choosing to self-manage with medication abortion by mail and telehealth for a whole variety of reasons, for the convenience of it, to be able to manage the experience at home or in a safe, trusted location, for the low cost of it, for the confidentiality, depending on someone's situation or their relationship. It's really important. For the preference, just wanting this kind of experience for their body instead of surgical abortion, which is more invasive, and for self-determination and overcoming these unjust restrictions that are blocking access to an essential healthcare. So just a quick note on travel. What about travel? There will always be reasons why a person might need an in-person service again, whether it's preference or whether it's a medical reason. But we're trying to get the word out right now that before a person assumes that they need to travel to another state, before they book travel, we want them to understand the full range of options, including potentially the option for self-managing an abortion, if that's something that they would prefer, and that they understand the context around it, that they look into the medical considerations and the legal risk. We feel like that's a really important part of the conversation right now, as we also hear so much about people preparing to go to other states and travel. You might be able to manage your own abortion right there at home. And so as a campaign, our two goals are that people know about this method and that people have access to this method. And as part of the people know part of our strategy, we are in the business of getting the word out. And we do this under the belief that our right to select and access care should not be determined by our zip code, and this medication belongs in the hands of those who seek it. So we do things like run poster campaigns in the New York subway. This was up in April and May. I think it's actually still up in many subway stations. Got a lot of really good press and generated a lot of dialogue, again, for people that just don't know that this is even an option. You can see it ran alongside of ads for If, When, How, and the Repro Legal Helpline to ensure that those two messages were side by side. We also have stickers that people are using all over the country. Hundreds of thousands of stickers are out there now. We have an ambassadors program where people are being trained on this information and finding ways to plug into the community and to committees that are forming to get the job done, to get information out there. And we do get a lot of press and PR for our guides. So we that's another way to engage with this information is you can find articles online about post-Roe abortion access and find ones that talk about Plan C and learn more or share that out. And again, just to this question of I know I put this here because it's a very common and very understandable question. And just wanted to mention again that we do work closely with If, When, How, the Lawyers for Reproductive Justice, who say that self-managed abortion is not a criminal act and that the country must stop criminalizing it unjustly, and that law enforcement has no place in people's reproductive lives. So we know that the legal landscape is rapidly changing, that we're waiting on a SCOTUS decision. We know that people are more likely to be criminalized from certain backgrounds of socioeconomics or race or ability. And that's why resources like the Repro Legal Helpline exist, specifically to serve and support people in understanding their rights and taking care of themselves. And our website also includes FAQs and alerts on the guide to be sure people are making their own decision about risk, that they know all of it and can make a decision that's, again, best for them. So despite all of this, despite everything that's going on in the country, we still have hope. And it lies in this method, in these 5 pills and in the ability for someone to self-determine their outcomes. So online access has already changed so quickly in the past couple of years. Again, I'm grateful to get to share this with you and you get to absorb this into all of the good information about birth control and abortion access from a company or HR perspective. And that this is something that individuals just need to know, that abortion pills are here and that it's a really safe and effective method. And once someone knows this information, then whether or not they ever need it, now you know. And I will turn it back over to Delasi. Thank you so much.
Thank you, Amy. That was fantastic. I did see a few questions in the Q&A, but Dr. Yen has swiftly jumped in to take those. I don't see any other questions, which is a sign that Amy, Shelley, Dr. Yen, you've been extremely thorough and given everyone all the information they need. This has been an awesome presentation. We are at time, but I just want to remind everyone that we're going to have the recording of this presentation available on the ASBN website by the end of today. So please share this widely, these resources, this information that we got today. I've learned so much. I know everyone here has learned something they haven't known before. So please spread the word, because I know for those who are employers, this is information your employees need to hear. Thank you again, Amy. Thank you, Shelley. Thank you, Dr. Yen, so much for doing this for us.
Thank you.
Thank you.
Bye, everyone.
For having us.